Hey future doctors, today we are going to see about routes of drug administration. So most of the drug can be administered by the different routes. And there are two type of routes. First is local and second is systemic. In local, there are different routes. First is topical, then intra-arterial, then tip tissues. And in systemic, there are again two routes, that is internal and parenteral. In internal, we can use different routes, that is oral, sublingual and rectal. In parenteral, we can use injection, inhalation and transdermal. Now we are going to see all these things one by one in detail. So first is local route. So this is the simplest mode of administration of drug and it is at the desired site action. Then the systemic side effects are also minimal, as we discussed earlier that the action is on the desired site. Then first is topical. The drug is applied to the skin or the mucous membrane at the various site for the localized action. For example, in oral cavity we can use creams, ointment, spray. For example, vancomycin or sucralfate. And in GIT we can use tablet which is not absorbed. For example, neomycin. Then third is rectum and anal canal. In this we can use two things, enema and suppository. So what is enema? It is the administration of a drug into the rectum in a liquid form. So in a liquid form, a drug is administered into the rectum. This is known as enema. And in suppository, we administer the drug in a solid form into the rectum. There in the enema and suppository, that in suppository there is solid administration and in enema there is liquid administration. The next is eye, ear and nose. Here we can use drops, ointment, spray. For infection, allergic condition we can use it. And here example is gentamicin, that is used as a ear and eye drop both. The next is bronchi. So for bronchi we can use it as inhalation, and example is salbutamol. Then for vagina we can use tablet, creams. For urethra you can use jellies. Then skin as a ointment, cream, lotion, powder. And an example is clotrimazole. The next thing is intra-arterial route. So this route is actually rarely employed and mainly used during the diagnostic studies such as the coronary angiography or for the administration of some anti-cancer drugs. For example, in the limbs there is malignancy. In that cases we can use intra-arterial route for the treatment. The next is deep tissue. In deep tissue, we can administer the drug into the deep tissues by the injection. For example, administration of triamcinolone directly into the joint spaces in the rheumatoid arthritis. So in the rheumatoid arthritis, we can use this drug directly into the joint spaces. Now next is systemic routes. So drug administered by this route enter the blood and produce systemic effects. So here are two ways, that is the enteral and second is parenteral. So we will see these both routes one by one. First is enteral route. In this we can include oral route, sublingual route as well as rectal route. So we will first see oral route. It is the most common and acceptable route for the drug administration. In this there are different dosage forms, that is tablet, capsule, powder, syrup, mixture as well as suspension and many more. For example, paracetamol tablet, it is given for fever, and omeprazole capsule, it is given for peptic ulcer. And these both things are given orally. Now tablets could be coated or uncoated, both it can be. And the drugs can be also available as the chewables, for example albendazole, as well as dispersible, for example aspirin, mouth dissolving for ondansetron, and sustained release forms. Again, there are many ways for the oral route drug administration. Then capsules can have a soft or a hard shell. Now there are some advantages and disadvantages of all the things. So here are some advantages of oral route drug administration. First, it is safer, then it is cheaper, as well as it is painless, and it is convenient for the repeated and prolonged use, as well as it is self-administered. This is the most important thing, okay? Now let's just see about the disadvantages. First is it is unpalatable and it is highly irritant drugs. This can be a disadvantage of the oral route administration. Then it is also unabsorbable drug, for example, aminoglycosides. This is an unabsorbable drug which cannot be taken through the oral drug route. Drugs that are destroyed by the digestive juices, for example insulin. Drugs with the extensive first-pass metabolism, an example is lignocaine. As well as in the unconscious patients, we can't give oral drug route administration. As well as in the uncooperative or the unreliable patients. In this also, we can't use oral route administration. And as well as in the as an emergency case. Because as we know that the orally administered drugs, they act slow. The next is sublingual route. It is kept under the tongue and drug is absorbed through the buccal mucous membrane and enters the systemic circulation directly. So here first pass metabolism is fast. Then examples are nitroglycerin, that is used for acute attack of angina, as well as buprenorphine. Then there are some advantages and disadvantages of the sublingual route. Then first is quick onset of action of drug. When we will keep some tablet under the tongue, it will act quickly. Then the action can be terminated by spitting out the tablet. It bypasses the first pass metabolism and it is self-administered if possible. Then there are some disadvantages also. It is not possible for the irritant and the lipid insoluble drug, as well as with the drug with the bad taste. In this case also it is not suitable. Then third is rectal route. In this we can give drug in the form of suppository or in the form of enema. So for suppository, you can use the local effect as well as systemic effect. For example, indomethacin for the rheumatoid arthritis, and enema, it is used for the local effect as well as systemic effect, and drug is absorbed through the rectal mucous membrane and produce systemic effects. Example is diazepam for the status epilepticus in the children, and methylprednisolone enema in the ulcerative colitis. So these three were the routes of the enteral route. Now we will just see about the parenteral route. Now routes of drug administration other than the enteral route, that is known as parenteral route. So here are some advantages. First is onset of action of drug is faster and hence suitable for emergency. Then it is also useful in the unconscious patients, that uncooperative as well as unreliable patients and patients with the vomiting and diarrhea. In these cases we can use parenteral route of drug administration. As well as it is suitable for irritant drugs. Then drug with the high first pass metabolism, drugs not absorbed orally and drugs destroyed by the digestive juices. In this all cases we can use parenteral route. Then there are some disadvantages also. It requires the aseptic conditions as well as preparation should be sterile and is expensive. It also requires the invasive techniques which are painful and it cannot be usually self-administered, because in oral route or in the sublingual route we have seen that it is self-administered, but in parenteral route it cannot. As well as it can cause the local tissue injury to the nerves, vessels and many things. First is inhalation. This is the volatile liquid and the gases are given by inhalation for the systemic effect, such as general anesthetics. Then there are some advantages, that is the quick onset of the action, then dose required is very less, so systemic toxicity is minimized and amount of drug administered can be regulated. And there are disadvantages also, that the local irritation may cause increased respiratory secretion and it can cause the bronchospasm. So next is injection. We can give it in the form of two routes, that is intradermal route as well as subcutaneous route. In intradermal route, the drug is injected into the layers of the skin. For example, BCG vaccination as well as drug sensitivity test, these both are given as the intradermal route. And it is painful as well as small amount of drug can be administered. So these are the disadvantages of the intradermal route. The next is subcutaneous route. Here the drug is injected into the subcutaneous tissue of the thigh, abdomen and arm, such as adrenaline and insulin. These both can be given as the subcutaneous route. Then there are some advantages and disadvantages. So in advantages, it is the self-administration of the drug is possible in this, for example insulin, as well as in this preparation can be inserted into the subcutaneous tissue. And here example is Norplant for contraceptions. So for contraception, Norplants are injected into the body. Then there are some disadvantages also. It is suitable only for the non-irritant drugs and drug absorption is very slow, hence it is not suitable for the emergency. Now this is the diagram of the injectable routes of drug administration. In this way we can give intradermal injection, then in this way we can give subcutaneous, then here intravenous, then here intraarterial, and then in the muscles we can give intramuscular, and here we can give intraarticular. In intradermal it is given in the skin, under the skin layer, then intravenous all we know that in the veins, and intraarterial in the arteries, and intramuscular in the muscle, and intraarticular means here between the joints, bones. The next route is the intramuscular route. Here the drugs are injected into the large muscles such as deltoid, gluteus maximus as well as vastus lateralis. Example is paracetamol or diclofenac. Here the preferred volume is 5 to 10 ml and it can be given at a time. So here are some advantages and disadvantages. First advantages we will see that absorption is more rapid as compared to oral route, and here mild irritants, depot injection as well as soluble substance and suspensions can be given by this route. All these things can be given by this route. Then disadvantages, aseptic conditions are needed and intramuscular injections are painful and may cause abscess. As well as self-administration is also not possible and it may cause the injury to the nerves. So these are some advantages and disadvantages of the intramuscular route. Then we will see intravenous route. Here the drugs are injected directly into the bloodstream through the vein. So drugs are administered as the bolus and slow intravenous injection or in the form of intravenous infusion. So first we will see about bolus. So in case of bolus, we can give large dose of drug injected rapidly or slowly into the vein. And an example is IV ranitidine in the bleeding peptic ulcer. The next is slow intravenous injection. Here example is IV morphine in the MI. Then intravenous infusion, example is dopamine infusion in the cardiogenic shock, as well as mannitol infusion in the cerebral edema, and fluids are also infused intravenously in the dehydration. Then here are some advantages and disadvantages. First we will see about advantages. Here the bioavailability is 100%. Then there is quick onset of action, so used in the emergency. An example is IV diazepam. It controls the epilepticus in the children's. Large volume of fluid can also be administered. Example is IV fluids in the patient with the severe dehydration. Then highly irritant drugs such as anti-cancer drug, it can be also given. Then next there are some disadvantages. First, the local irritation may cause phlebitis. Then self-administration is usually not possible in this case. And strict aseptic conditions are also needed. Then extravasation of some drugs, for example, noradrenaline can cause injury, necrosis or slowing of the tissues. Preparation cannot be also given by the IV route. So these are some disadvantages, as well as there are some precautions for this route. So drugs should actually be injected slowly. Before injecting, make sure that the tip of the needle is in vein. The next is intrathecal route. So here the drug is injected into the subarachnoid space, such as lignocaine in the spinal anesthesia, amphotericin B as the antibiotics. The next is transdermal route. Here the drug is administered in the form of patch or ointment that delivers the drug into the circulation for the systemic effect. For example, there are some different patches for the different things. First is scopolamine patch that is used for the sialorrhea and motion sickness. Next is nitroglycerin patch for angina, then estrogen patch for the hormone replacement therapy, and nicotine patch for tobacco de-addiction. So there are some advantages and disadvantages also. So first is that self-administration is possible in this. Then patient compliance is also better. Then duration of action is prolonged and systemic side effects are also reduced. Then there are some disadvantages also, that this is expensive and local irritation may cause dermatitis and itching, as well as patch may fall off unnoticed. So these are some advantages and disadvantages of the transdermal route. So this was all about routes of drug administration.